Well, is the world finally starting to win the fight against AIDS? With the number of deaths and new infections now falling, the 19th International AIDS Conference has been told the end of the epidemic is now possible.
Bill Bowtell is considered the architect of Australia's response to AIDS, thanks to his work as an advisor to the Federal Health Minister in the 1980s. He also worked with Prime Minister Paul Keating. He's now the Executive Director of Pacific Friends of the Global Fund, and he's in Washington for that big AIDS conference. Bill Bowtell, good morning to you. Do you believe the battle is being won?
Good morning. Indeed it is. We're well on the way to the great target of achieving an AIDS-free generation. We had a really inspiring address this morning here by Secretary of State Clinton, and she confirmed what I think all the people now know who are attending this conference, that the end of AIDS is really within our grasp. It is something we can talk of for the first time in the 30 years of this dreadful public health challenge.
And what's led to this burst of optimism?
The first and most important thing is that we have effective treatment, so that in the 1980s, when we first had the problem emerged, AIDS was a death sentence. If you got it, you were going to die. But now with effective treatments, people can live long and productive lives if they have access to treatments. In places like Australia, of course, everybody who needs it has treatments, but in the rest of the world there are still 8 million people who do not have access to treatment. So the more people we treat, the more effectively we prevent the transmission of the disease, because people who are being treated are less infectious with the virus. That's better for them, of course, but better for society generally. So we need to close that gap to get the 8 million people who are not on treatment now in the world on treatment, and then we'll see further declines both in new HIV infection rates and in death rates from AIDS. So we're getting there, but we do need a lot more money. There's about a $7 to $8 billion funding gap, and that has to be filled through such institutions as the Global Fund, and Australia's got an important part to play in that. We should be contributing a lot more to the Global Fund and to the international effort than we are at the moment.
OK, so how much more would you like Australia to contribute, and do you believe that this country has been dragging its heels on funding?
Well, Australia came late to the Global Fund. It was set up about 10 years ago. I'm happy to say the last time that the fund went to the donors for money, Australia did increase its funding rate substantially by almost 60%, but we still only give about 2.5% of the total funds required by the Global Fund, and we can do a lot better. The Global Fund will seek more support next year in 2013, and I think we should really step up to the plate. I know we have fiscal and budgetary problems, but believe me, they're not anything compared to the problems that you can see here in the United States or in Europe. So we could do more. If we do more, we'll be rewarded. We'll start to get on top of this epidemic. Australia had a great track record in the 80s and 90s. We almost led the world in our response, but I'm afraid in the last couple of years we've seen that response become a bit moribund. Here, one of the big things we're talking about is the need for rapid testing kits, because the more people who get tested, the more they know their status, the quicker we get them onto treatment, the better it is. Almost every country in the world has a regime for rapid testing kits, but we don't. Now, we should really step up to the mark on that. We should step up to the mark on adopting targets. 1,000 Australians a year are infected with HIV. We should adopt the UN targets and reduce that by 50% by 2015 and start to get that down. It's just a matter of organisation and political will, and I think if we do that, we can be in a very strong position, because our contribution has been recognised. Melbourne is going to be the city that hosts 25,000 delegates of the AIDS community in Melbourne in 2014, in 2 years' time, the conference after Washington DC. So I'd like to see us get all of our ducks in a row, as it were, that we step up to the plate and make that contribution.
OK, and finally, and it's obviously lots of encouraging stuff, Bill, coming from that conference there. Do you believe the end is in sight? Do you believe the battle will be won in, for argument's sake, your lifetime?
I think, as Michelle Sidibe, the head of UNAIDS, said, that we are getting to that point, yes. I think that another generation, 25 years, at the end of that time we can talk about the great goal of an AIDS-free generation. That is nobody being infected by this dreadful disease. And if that happens, that'll be such a tremendous success in global public health. We will put behind this, we'll put it in the rear view mirror, and that would be a tremendous thing. So we can't slacken off in this last mile. We've got the Olympics coming up, you know. You can't slacken off in that last lap around the track. That's when you've got to double your effort.
Okay.
And if we do, we'll get there.
Bill Bowtell, let's hope we do get there. Thank you very much for joining us this morning.
Thanks, Michael.
Let's get to